Well, hi everyone, this is Dr. Schroeder with this week's video introduction to week number 7 of our course in patient and staff education. And once again, a very lively and a very nice discussion this week. This week's discussion focused on continuing education, and you were posed with the question of how would you handle it if you were working in a state where there were no CEU requirements. How would you go to ensure that you were providing uh, the correct quality, the correct continuing education for the state that you were operating in? How would you go about assessing that? Or at least that's really what the gist of the question was how would you assess? How would you know? And I gave some background about this last week and within the discussion itself. But there are many states that don't require continuing education. However, that doesn't mean that continuing education is not expected. In those states where there is no quality uh, or continuing education required for nurses, it is because the State Practice Act usually requires the hospitals to provide that and essentially puts the onus on the hospitals, and the hospitals have to show that they are providing those hours. And so it's very important that the nurses need to know, and nursing educators need to understand that you have to provide a certain number of hours for a particular unit, and should be monitoring nurses to make sure that they are complying with whatever that particular hospital's plan is. Most hospitals, at least to my understanding, do not require a certain number of hours necessarily. They do need a certain number of hours of availability for education, usually around 10 hours a week or so, where nurses are available to sign up and to partake of those classes. But it's pretty much unit specific or hospital specific as to how many are actually required. I've seen some hospitals require as few as 30, others as much as 60 in a given year. It just depends on the hospital, it depends on the jurisdiction, it depends a lot on what the community standard is. But once again, a very good discussion. And I apologize, by the way, I announced in my video last week, which really was just a few days ago, it was kind of came late in the week, that your QSIN PowerPoint was going to be due at the end of the week, and I think everybody was like, oh no. I'm sure everybody was like, oh no, it's due sooner than I thought. It's because I messed up. It's actually due this week. So it was not due on Sunday. It is due this week. And I've received some emails, and we talked around a little bit about QSIN. QSIN stands for Quality and Safety in Education of Nurses, or nursing education, and it is become a real standard. Prior to QSIN, most of our standards were generated, quite frankly, by the Joint Commission. The Joint Commission accrediting standard was that nurses had to show competencies. And competencies is kind of a vague term, or was kind of a vague term. We still see it used occasionally, but it is not. It's a term that is going out of favor fairly quickly in terms of this acronym, the KSAs. So we are expecting nurses to show certain KSAs, and K is knowledge, S is skills, and A is abilities. And the same thing is really the competencies. It means that a nurse should have an understanding and certain skills and the ability to demonstrate certain skills in regards to the things that they do, particularly those things that are particularly high risk. For example, common things are like fall risk, medication errors, and passing medication, and these sorts of things all fall under this umbrella of QSIN. And so you're going to have a discussion question on QSIN this week, and you're going to find an article, and looking at it specifically, I've got to put on my glasses just to make sure I'm reading it correctly. You're going to choose an article which relates to an area of nursing in which you have an interest, list the name, author, and a brief synopsis of the article, and then answer, how could you use this? How would you use this particular article to educate your nurses within a QSIN framework? And in other words, the idea of QSIN is, like a lot of things in nursing education, like everything in nursing education, it should be based on evidence. The new term that we're using now is evidence-informed practice. Evidence-based is, again, a term that is being supplanted by this evidence-informed. What does the evidence show? what studies have been done, what evidence can you provide to your students to help them to be safer practitioners and to help to measure and assess their abilities in terms of safety nursing practice. And that pretty much takes care of our week. So your cues and presentations are due this Sunday. And of course, the discussion questions are your initial response due by Wednesday, with your follow-up responses due by Saturday. Note, next week, it is a shortened week next week. Next week is week 8. We're at the end of the term, or we got just one more week after this one. So please note, as you're planning your schedules, note what those start and stop times are for the um, you know, for the discussions in week number 8. You don't have any written assignments so week 8 other than the discussion questions, but they are due early. We do finish up everything by Thursday. So I will leave that to you. I hope that everybody has a great week. For those of you that are Pittsburgh Penguins fans, congratulations. Those of you that are NH fans at all and like Pittsburgh, my hat's off to you. I personally don't fall into that camp, but you can't win them all. And I do have to say that they are quite a team, and they're quite the powerhouse this year, in the last couple of years, actually. So those of you that are hockey fans, and those Pittsburgh fans especially, good deal. You have a lot to celebrate. So anyway, I look forward to seeing you in class. Look forward to participating in discussion. Let me know as you have questions, and we'll see you in Blackboard.